Hello again and welcome to Forum for a Better Understanding. It is so exciting to be back again in the middle of a three-part series on such an important topic as mental health and faith. And we have assembled again a wonderful panel to look at a very difficult topic, is the desperation and the gravity of mental illness that could push one to even contemplate or actually affect suicide. We have assembled a very wonderful panel, and our first guest is a new member of the Forum team, and that is Dr. Scott Aliz, who is the Chief of Psychiatry at Community Medical Center and a Professor of Psychiatry at UCSF. To his side is a friend who has been on many times, Imam Syed Ali Ghazvini, who is the spiritual leader of the Community of Islam at the Islamic Cultural Center of Fresno. And to his side is another new guest, a Mennonite pastor, Reverend Tim Schellenberg, who winds up being a chaplain in hospice at St. Agnes, and the three of them, professionally and personally, have real connections to this issue. And I am so glad that we were able to make this a second part of our series, and that these three guests now will tell us why it is that their faith in some way connects with their professional life to make this a topic they'd like to share on the forum. Scott, could you begin by telling us a little bit about yourself and your connection to this topic?
Well, I am affiliated with the University of California San Francisco Medical Education Program based here in Fresno and centered at Community Hospital. We have several training programs there for people who want to specialize after they finish their medical school training, including programs in internal medicine, surgery, pediatrics, and obstetrics. The program that I'm affiliated with is the Psychiatry Residency Training Program, and we train people who have finished medical school and want to become psychiatrists. We are especially interested in the topic of suicide because we see people with suicidal ideation or people who've made suicide attempts every day. We are involved in the evaluation and treatment of those people.
Thank you for being on this program today, very much.
You're welcome.
Imam.
My name is Syed Ali Ghazvini. I am the Imam of the Islamic Cultural Center of Fresno. At the Islamic Center, we are active in many areas, and interfaith and education. And we try to provide what the community needs to be a healthy and vibrant community. We provide education, and especially on health in general, and mental health is an area where we been active to offer education and awareness to the community.
Thank you. Reverend Schellenberg.
Yes, glad to be here. When I was a young boy, my dad was a Mennonite pastor. One of our parishioners committed suicide, and I saw firsthand the impact of that in the congregation and the lives of the people of our congregation. Also, I've had experiences in my work as in alternative service with people who committed suicide, and also in my own family there have been members and our relatives who have committed suicide. In my work as a bereavement coordinator at St. Agnes, again, I get phone calls from people from the community who've lost a loved one through suicide. So this topic really speaks to me and of my interest to provide hope and to be with people who are have suffered the loss of a loved one through suicide and to give them support.
Well, we hope that those who are watching this program will be finding out that there are definitely resources available for all of those who find either in themselves or in family members or community members the need for mental wellness. And I think we have three guests now who will address this very, very concretely and very positively. Dr. Aliz, if you could begin by giving us some real background on suicide. The question might be its relationship to mental illness, the number of attempts, and also the sad fact of so many completions. Also, the populations at greatest risk. And finally, looking at the issue of how faith, be it Jewish, Islamic, Christian, could in some way be an antidote to this. So where would you like to begin with the conversation?
Okay, well, just some of the basic statistics. In the United States, there are about 30,000 completed suicides per year. That's approximately one every 18 minutes. There are a ratio of about 20 suicide attempts to every completion.
Oh my.
And of the people who commit suicide, approximately 90% of those people have some sort of mental illness, depression, bipolar disorder, schizophrenia, or schizoaffective disorder. There are, besides mental illness, many other risk factors for suicide. Certainly stress in a person's life is a risk factor. Family stress, marital stress, financial stress. Actually, being male is a risk factor. Males commit suicide much more frequently than females. Age is a risk factor. The older a person is, the greater the risk of suicide. Being divorced, widowed, or alone is a risk factor. Living in poverty or being homeless is a risk factor. Medical illness or disability are risk factors. And alcohol and substance abuse are risk factors. On the other side, a protective factor is one's religious faith. I see many people who have suicidal ideation, but who tell me that they would never act on that ideation because of their religious faith.
One thing that you made me think of is are there countries that for some reason statistics show have a disproportionate amount of suicide or suicide attempts? I'm wondering about the United States. How do we stack up as a culture vis-a-vis the rest of the world?
Well, the United States is one of the countries with a higher rate of suicide. Actually, the highest rates of suicide are the Baltic states in Europe and sub-Saharan Africa.
And do you find a possible reason, or is it just that the factors that you mentioned are found in those cultures, these very difficult populations?
It's not exactly clear what all the factors are, but some people have pointed to the sort of the high-paced, stressful life that we tend to live in the Western world as being a significant factor.
Now, would you want to help us out? It's good to always, I think, put a picture to things. We can have statistics of 30,000 suicides, but it would be nice to know a picture of maybe one faith community that you maybe think they wound up being actually a form of rehabilitation, a form of salvation, help, energy, positivity.
Well, I can tell you a story of a young woman that I treated one time who developed schizophrenia. She happened to be Seventh-day Adventist, and her church was very wonderful in helping with the treatment of her. They provided her not only spiritual support, but all sorts of psychosocial support. They helped with housing and financing and food. They helped with transportation, getting her to her appointments, making sure she took her medication, and made a very significant contribution to her treatment.
Now, fear and shame seem to be the biggest stigmas that just make it hard to deal with mental illness. What is it that you think religion could possibly do to make, well, how could religious leaders overcome their own, perhaps, fear and shame at thinking of this as an illness that they don't know how to handle? How could we make religious leaders more comfortable?
Well, I think that everyone has sort of the Hollywood image of what a mentally ill patient is, but the reality is that most people with mental illness aren't really all that different than you or I. They're real people with real problems, and so I think some education would help dispel much of the myth of mental illness and help people get over some of the stigma and fear that's associated with that mental illness.
In a church setting, a mosque setting, a synagogue setting, how might that education be affected? It's the answer is education. It seems like in the economic issues in the world, it's education, and in the issues of so much of violence, if we were educated. How would we educate in this sense? How might be some models of education?
Well, I think that most religious organizations have members who are mental health professionals who could certainly help with that. Certainly we as the university are in the education business and would be happy to help with that educational process.
We want to mention that NAMI FaithNet is one more of those groups that is definitely combining high science with faith-based community efforts and bringing together the community and those that can provide health wisdom on this. Tim, I think you had something to add at that point?
Well, just simply the importance of beginning to talk about it, I think, in the congregation, that spiritual leaders are open to talk to parishioners, perhaps on an individual basis, but perhaps also from the pulpit, that it's not simply a matter of sin and condemning sin, yeah, but it is a real illness that affects people, and there's a lot of confusion out there among our parishioners about what is wrong. Sometimes they feel it's my fault that I feel this way. If I would just read more scripture or do more spiritual things, I could get a handle on this. But often it's an organic a medical problem that they are facing, and they need help. And that's very important to open and to bring to the public.
Absolutely. Now, Imam, Islam has had a tremendous contribution towards mental wellness and health from its inception almost. Do you want to trace briefly how Islam itself tries to deal with this from the very beginning with its first mental hospital, and also how it is at the Islamic Center you're currently offering programs that reflect this care of Islam for the whole person?
Well, Islamic civilization advanced greatly in medicine, science, and healthcare. I would say Muslims were first to establish hospitals, including mental hospitals. The first mental hospitals was established in Baghdad, 705 AD.
Wow.
A very professional with records keeping of the patient. You know, when a specialist come and see the patient, they would keep the records and you know, for further references if they need it. And they offer their services free of charge. About 100 years later, another one was built in Cairo, and then followed by Aleppo, by Tunisia, and Morocco, and Mecca, Medina, and the most modern one were built in southern Spain, Andalusia, in Cordoba and in Granada, where even patients used to come from Europe, other parts of Europe, to receive services at these centers. I would say at their time they were very advanced with bath facilities and separate wards for men and women. In terms of today and our activity, you know, I would like to add a very short note here. Modernity has made our life easy in many areas and discovered many medicines, but in some areas actually increased the rate of illnesses. Diabetes, depression, cancer, AIDS is something that 50 years ago our fathers and grandfathers were not aware of, and mental health illness. So this is an area what concerns us as a faith community, and we would like to offer what we can to our community and to others. Our facility is open for everyone. We started offering health education in general to community members and other, including workshops on depression, for example. A specialist came to our center, I would say 3 years ago, nice, and he made a survey. He gave us, including me, he gave us certain questions, and he said every individual in the community has a little bit of depression or more. You know, it could be this much or it could be high. According to this survey, we would know how much depression every individual would have. We also organized workshops on domestic violence, other health issues and family issues. And recently we received a grant from Common for education on breast cancer. So we are active in both areas, actually, general health and mental health.
It's amazing how many things are going on at the ICCF. It's just very positive. And it might be a plug if you wanted to find out many of the activities. You just go to the website,
icfresno.org.
icfresno.org.
Yeah.
And that will introduce you to the Islamic Cultural Center of Fresno. And there's so many activities. Some of them are educational. Some of them are just wonderfully calling the community out to pray or to discuss important issues. Thank you, Imam, for that.
Yeah.
Now, one thing that's going on in life is people have relationships that fall apart. People have difficult personal connections with other people. That could also, I suppose, and is statistically a reason also for tension and also suicide, I suppose.
Thanks God we did not have so yet such a case in members of the congregation. We had cases of suicide of Muslims, but people who do not attend regular service. This is an area where we can prevent. Mostly we can prevent by offering education. But when there is a real case, we prefer that people refer to a specialist, a center, or a licensed individual who can offer specialized care in that. But I would say community centers and care and faith centers are good at preventing such cases from happening, by offering education in early ages and awareness.
Another point that I think you wanted to make clear to us, Islam has a respect for life that is very much in the Roman Catholic tradition, it seems, from womb to tomb, and it includes everything, homicide, suicide. Do you want to just make that point so people will appreciate Islam's understanding of respect for life? It's so precious.
Absolutely. In our faith, protecting life is a must. Our divine book, the Quran, has mandated on every Muslim to honor lives of others. This is why abortion in our faith is not accepted unless it creates a threat upon the mother's life. Including suicide. Basically, it's wrong. And we tell people, if you think you are escaping pain by committing a suicide, think again, because in other life, you might not get rid of the pain. So you might face more pain in other life. And actually, we would like them to go and see a specialist when they reach a serious stage. And we try to offer them hope, reason for living, because most of those either have a tremendous amount of pain that they cannot bear, physical or mental pain, or they lose hope for living, So what we can do is to offer them hope and make life meaningful for them.
Tim, that would bring up a chance for you to share on if isolation is really one of the major both causes and it seems result of depression. What is it that you see a faith community able to actually do to assuage that isolation and actually offer an alternative?
I think a faith community is so important because not only do people gather there, they're gathering there because they're unified in what they believe. They are there because they want to fellowship. But so often church or your faith community is a place where we think it's where we just get this information or where something that's required of us that we do and then we do it. churches, faith communities offer so much possibility in building relationships. It would seem natural that it would be the place that where we could come together, meet people of like mind, and talk about our problems, to make those significant relationships with people who are in many ways similar to us in belief and perhaps background. And I think the whole role of the faith community in building relationships is so important and needs to be encouraged by the leaders of these faith communities.
Now, the one thing that's true about that is that ideally it would seem that the faith community, and science bears that out, could definitely be a healer and a source of conversion and peace and transformation. But on a Sunday morning, does it actually happen? Meaning, or a Saturday or Friday night, does it happen that the communities are fulfilling their possibilities, or do we have structures in them that almost inhibit what would be this relational community? I mean, do we have relational community, or people dressing up to go to prayer?
Yeah, I think that's a real true thing. We have people who dress up and make their appearance and they go back home. I think spiritual communities need to invent ways so that people can meet and talk. Perhaps it's small groups. Perhaps it's a forum, an information forum that a faith community will hold perhaps after their worship or before, or in some kind of forum that information can be given, that topics can be broached that are difficult in a worship service. So there has to be those creative things done to open up the topic and to begin talking about mental health, relationships. We have so few significant relationships. Yeah. Studies show these days that a person may have 4 or 5 significant relationships and maybe no one they can call even a best friend. They have good acquaintances, but often no one that they could really open up to and share their deepest hurts and pains.
Could you share with us the Amish model, which for some will come as a breath of fresh air, just to think some communities still do this?
Yeah. The stigma of mental health and issues such as we've talked about suicide in our Western society is so overbearing that we kind of don't even it's hush-hush. We don't talk about it. I was at a Mennonite mental health, or Mennonite health symposium back east, and we were meeting together with other Mennonite chaplains. And I was talking to a Mennonite chaplain who said that in their facility, they have recently opened their doors to Amish, and they provide housing specifically for Amish. But he said what was most interesting for them was how the Amish approached mental health. They had no stigma. They had no background that this was something that you should be ashamed of. And so they would come in big vans, uncles, aunts, brothers, sisters, maybe 10, 15 people would come to bring their brother to this facility because they stood behind him. And they were encouraging him, and they wanted him to know that they were with him.
It's too bad that those experiences that you just shared with the Amish community seem so rare that they're almost like, well, isn't that a sign of hope? Dr. Alez, I wonder, we've almost a few minutes left only. You've heard the Imam and Reverend Schellenberg. I wonder if there's anything you'd like to almost make sure in conclusion you're able to either echo or to offer one more insight into this phenomenon of mental health and faith and the relationship.
Well, I think that faith organizations can be very helpful in treating people who are depressed or have mental illness or who become suicidal. They can provide not only spiritual support, but also the type of psychosocial support that I mentioned in the case of the young woman that I treated. And I'd just like to encourage anyone who is experiencing suicidal ideation to seek out treatment, either to go to a hospital, a mental health facility, or see a clinician in the community.
Now, in the sad reality of suicide, there is a number I think you wanted to, we'll post it now if we could. It's the Fresno SOS, Survivors of Suicide Loss, 322-5877. Tell us what SOS is all about.
SOS is an organization to help the family and friends of a person who has actually committed suicide. I have personally dealt with many people who've had family members who've committed suicide, and they've found SOS to be extremely helpful to them.
Let's give that number one more time. It's 322-5877 here in the 559 area code. It's very important that people appreciate the preventive quality of therapy, but then sometimes there will be the need after the fact, and it's the immediate family and those that are maybe most impacted at the tragedy of what would be a loss through suicide. This is a very important group, and they're very accessible to us here in Fresno, so please think of calling SOS if this is something you would be possibly needing. Imam, you get about 30 seconds to give maybe a final thought from your point of view and your vantage point on this topic.
You see, just by being a member of a faithful community, that would reduces the risks of having a mental health because it provides a network of a friendship, brothers, sisters, and also spiritual support available for everyone. I would like to say to people out there, whether you are a Muslim or a Jew or a Christian, just be a member of your own faith community, and that would really reduces the risk of having a mental health illness.
Thank you. Tim, final thought.
I would just like to emphasize how much I agree with that. In dealing with grief, I think one of the most important things in dealing with loss is, what do you believe? What kind of world do you believe in? What kind of God do you believe in? If God is good and He cares and His plans for you are good, that really helps in times of crisis and in times of depression to have that positive belief.
I want to thank this most distinguished panel that we've had today. It was one of the very best of the 205 we've had. I'm very happy. That was Dr. Scott Ales, Imam Sayed Ali Ghazvini, and Reverend Pastor Tim Schellenberg. All of you shared very, very well your faith and also the commitment to seeing faith communities as being an ally in mental health, being a source of light, encouragement, and support. And we hope that all of you who are watching will be here next week at this same time when we'll be having the third part of this very important series. Until then, God bless.